Hello, I am Dr. Alice Benton. I'm one of the co-hosts on New Life Live. We're going to talk about a difficult topic today. We're going to delve into the mind of a cutter. This is such an important topic because the prevalence of self-harm is increasing dramatically, especially in this year in 2020. There's been a concerning increase in self-harm behavior. We're going to look at why it happens, why someone would have the urge to purposefully self-harm, and what we can do about it. Perhaps surprisingly to any of you who have never engaged in self-harm, it's a relief to the person that does it. It's a distraction, it's a comfort, it's a rush. And it's a way to control their uncontrollable emotional pain and their inner turmoil. And I'm going to give a definition of self-harm. Most self-harm, especially what we'll be talking about today, is actually not suicidal, although it's always important to check and to ask about thoughts of suicide. But the kind of self-harm that we'll be discussing tends to be non-suicidal intent. It usually involves cutting, sometimes burning, sometimes just hitting, punching, hitting your head against the wall, hitting your head against the floor, and an extreme version is intentional bone breaking. It's very common that for people who engage in self-harm, they struggle with deep negative self-accusations. Some of the most common are the beliefs that I'm a disappointment, I'm worthless, and I'm unlovable. Those beliefs have fit for everyone that I have talked to and work with who have engaged in self-harm. There's almost always a strong self-hatred, whether it makes sense or not to an outsider, a strong self-hatred. It's not uncommon for the person to be questioning their sexual orientation and their gender identity as well. Self-harm usually goes hand in hand with a couple of different mental health disorders. There's almost always a background of some form of trauma, not necessarily big T trauma. Sometimes it's smaller T trauma in the form of bullying, but if you look far enough, there's usually trauma. Depression, anxiety, addictive behavior, and eating disorders. The age of onset is a painful 13 years old. And there's evidence that that age is being pushed younger and younger, but 13 is a fairly normal age of onset. Usually there's a friend group where self-harm is engaged in by multiple people within the friend group. Now, some good news, the majority of people that self-harm only do so a few times and then stop. It's much more uncommon for the behavior to continue long-term. We have to look at the role that media plays, especially in today's day and age, when it comes to self-harm. A lot of people find help through the internet and find solace with peers who can understand, who encourage, who support. So a lot of good can come from internet use with people who struggle with self-harm. Unfortunately, there's also a push to normalize the behavior within the peer group. There can also be competition to self-harm better than what you know your peers are doing. There's even a lot of reports of ridicule within that self-harming community for people who aren't self-harming significantly enough. So you might go in to get help, to get support, and to get encouragement. But there is a strong vulnerability to gather information and a competitive peer group that can actually make the behavior worse. Researchers have been finding that there is a large collection of photos of self-harm and even videos, live action videos of self-harm, as well as a lot of cartoon self-harm. Anime is a big genre that involves self-harm. And once adolescents start looking at that kind of material, it tends to trigger more significant self-harm. It can become part of the ritual of the self-harming behavior. People describe feeling a rush as they look at these photos and they look at the videos, and then a stronger urge on their own part to follow through. They report finding better techniques, meaning more dangerous techniques, to both self-harm and then to hide it afterwards. A couple of different social media forums have been named. Now, they've also taken action to improve this, but these different forums have allowed the photos and the videos in the past to be very accessible. They've shored this up and there is better security now. But some of the social media platforms like Pinterest, Snapchat, Tumblr, some of them allow anonymous posting. And then when algorithms are involved to bring to your attention things you've searched before and have been interested in the past, we all experience this with just the hobbies and the interests, the recipes we look for on these forums. We get more information. Well, the algorithms can also dangerously lead to more information about self-harm behavior. So what can we do about it? Well, if we love someone who we suspect engages in self-harm, there can be a fear to ask. It's like asking about the pain someone feels at the passing of a loved one. Should I ask? Won't it make it worse? What if they weren't thinking about it and I brought it up? We have to ask. Everyone I have worked with that struggles with this behavior has felt an anxiety, but also a relief at being asked and finally being able to tell the tale of what they've been doing, why they've been doing it, and what's been happening to them. They often feel invisible. They think that no one cares. They think it doesn't matter to anyone if they're hurt or not. And so when we ask gently and lovingly with the intention of helping, with the intention of hearing them out, there is relief for the person that engages in self-harm. With my clients that I know self-harm, I'll often ask them to show me their area that they cut, to show me their wrist, to show me their arms, as they tell me whether or not they've been engaging in self-harm in the last week and in between sessions. It's so important to go into history to find the roots to why they're self-harming, because there is a reason. As much as on the surface it might not make sense to us, there is a reason they're in that level of pain. Life makes sense, emotions make sense, and deep down there is a root to their initiation of self-harm, usually trauma. We also have to be very protective of our adolescents and of our children who are still under our roof by reviewing and being aware of how they're using their devices, because it's a slippery slope, it's a big black hole, and even if a child goes into this area innocently enough, it can really pull them in and suck them in. So as parents and as family members, it's important for us to take authority over this area, to step in to protect them. The comfort circle cannot be overlooked, because when people are self-harming, really they're trying to get comfort for a pain that they don't fully understand and that they don't know how to solve. And Mylan and Kay's comfort circle is such a simple, structured way to draw a person out, to hear them in their pain, and then meet them with the comfort that they need, and even helping them figure out what the comfort is that they need. If you're uncertain about your child's safety in this area, and if you do not feel equipped to ask, don't hesitate to talk with a therapist, to schedule a consultation. The therapist will be happy to talk with you as a parent, to give you information, to support you, to provide you feedback, and then to talk with the adolescent, to talk with the person that you're concerned about. And a professional is trained to handle this. Right questions and trained to bring in the right strategies and tools to help and to resolve that underlying pain. Do not lose hope, but do not be passive either. Take action. You can call us here at 1-800-NEW-LIFE and we'll get you started in the right direction.